Welcome to Pennsylvania Newsmakers. My name is Gene Barr. I'm your host for this edition of Newsmakers. Well, today we're going to be talking about semiquincentennial and then about how some Medicaid changes may impact us here in Pennsylvania. And we'll start that right after this.
Welcome to the fast-paced and unrehearsed weekly discussion featuring the leaders who help shape your world. Join us as we address the issues that impact you each and every day. This is Pennsylvania Newsmakers. And now, here's your host.
Welcome back to Pennsylvania Newsmakers. Our first guest here today is Cassandra Coleman. Cassandra is Executive Director of the America 250 PA Commission.
Yes.
So thank you for being with us here today.
Thanks for having me.
Say I have a little bit of a vested interest since I'm part of the commission, but tell us, I use the word semiquincentennial. It just really rolls off your tongue. What is semiquincentennial?
So it's the 250th anniversary of the United States, and America 250 PA is the Commonwealth of Pennsylvania's commission that was charged with planning and coordinating all of the efforts here in the Commonwealth of Pennsylvania. So we're really excited.
And of course, that's based on July 4th, 1776, which is why here we come, and next year is the big kickoff.
Yes.
And not the first time. Those of us who are old enough, some of us do remember 1976. We do, but this has traditionally been kind of a big deal in this nation's history.
Yeah, so I mean, obviously there's been anniversaries prior to this, but this is the 250th, and we're really excited. We've been planning for, as you know, about 7.5 years here in the Commonwealth. We've led the nation over the last 7.5 years, but listen, Pennsylvania is the birthplace of American democracy. Yes. So no other state can claim that. So we're really proud of the work that we're doing.
And this was created by legislation that the House and Senate, of course, passed, and as you note, 7.5 years ago? Mm-hmm. Wow.
Yeah, so 2018, the legislature passed the Pennsylvania Commission for the United States Semiquincentennial. Okay. And Governor Wolf signed it into existence. And here we are, all of the governors, our former governors, are our co-chairs. So it really shows the bipartisanship as well. And really just making sure that, every corner of Pennsylvania is involved and included. And of course, Philadelphia is where it's going to culminate. But, every community has a story to tell, and we're really excited to amplify that.
Yeah, and as you note, obviously this is a national celebration, but the prominence of Philadelphia, and what we've been saying all along is we can't mess this up because the eyes not only of the nation, but in many ways of the world are upon us. And Philadelphia is one of the prime centers of all this, correct?
Yeah, so there was legislation passed by Congress back in 2016, and one of the priority cities of celebratory events is Philadelphia. So Pennsylvania and our legislature and Governor Wolf back then were at the forefront of really making sure that Pennsylvania was one of the first states in the nation to have a localized commission, to your point, to make sure we get this right. We can't miss the mark. It's a historic opportunity, and we got to do this.
What are some of the other cities that are part of the focal point, as we call it? I think they're called
host cities. Sure. Yes. So it's Philadelphia, New York, Charleston, Boston, and D.C.
And you and your team have been extremely active on this, and I think that it's fair to say have been out and in front of most other states. I think is fair to say, because you guys have been at it a long time, and others. In fact, you guys hosted an event in Philadelphia last summer, correct?
We did. We actually hosted 42 states, all 67 counties, and over 300 in-state partners in Philadelphia for what we called the national convening, where we had 3 days of about 30-some events, about 800 people, to really showcase, Pennsylvania's leading role in the 250th nationally, but also come back. Here's what Philadelphia has, here's what Pennsylvania has. Come back, and not only come back to Philadelphia, but then travel around and see the other parts of Pennsylvania.
Correct, and of course there's a lot of, which we'll talk about here after our break, there's a lot of really big events here, and previous celebrations have resulted in some notable structures being built. Is there anything you could say, wow, we're going to build this and it'll be a remembrance of how we celebrated?
So currently there are conversations going on with the legislature on legacy projects like they have done in past celebrations and anniversaries. But for us at America 250 PA, we are installing bronze permanent semiquincentennial bells. Right. Hopefully one will go at the Capitol as well.
Okay.
But I think ultimately we're really trying to make sure that we're highlighting these communities as we do that.
Good. Well, when we come back, we'll talk a little bit more about some of the events that are happening, some of the other activities you guys are doing, and how this is going to differ a bit from what we did 50 years ago, and we'll do that when we come back.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back to Pennsylvania Newsmakers. My guest today is Cassandra Coleman, who's Executive Director of America 250 PA. We have to get that one right, and there's no spaces in there. So, talking before about some of the legacy projects and the bells that you're installing, but the other thing that I want to touch on, which I think is really critical, and I think most people have received this very well, is we tend to focus on Philly, but it's not the only thing we're going to talk about. And you guys have done some phenomenal work, particularly with things like the Dennis Farm, which is bringing out stories that were heretofore, in many cases, neglected. You have the Dennis Farm, the Hawley Silk Mill, and we're going to do one here in a few weeks at Camp Security. So particularly Dennis Farm is a fascinating story.
Yeah, so the Dennis Farm is where our first bronze permanent semiquincentennial bell was installed. And that was such an amazing day because we were able to lock that story into history through this historic anniversary. The Dennis Farm is the longest continuously owned African-American owned farm in the country. And it was founded back when 90% of African Americans were enslaved people. So therefore, really highlighting that story and to sit there and have the seventh generation, direct descendants of the family who founded the farm help us unveil that bell. It was just, again, a remarkable day. And it's just amazing to be able, again, to, as you mentioned, to highlight these stories. And that's what this is about. This is really about telling these stories about all locations across the Commonwealth, all regions, all counties, because every county and every unique community has these stories to tell.
And you guys have done a great job, and I think it's fair to say, and I want to expand on this, that counties, municipalities, historic groups, visitors groups have embraced what you guys are looking to do here. How many have signed up and are participating in your activities?
Pennsylvania was the first state in the nation to have all 67 counties pass an official resolution becoming partners to make sure that we are rowing in the same direction and really promoting Pennsylvania as a whole. I'm a former borough mayor, so really wanted to make sure we took that down to the ground level and, really organically grew this. So we have over 400 localities, boroughs, cities, townships, villages who have passed the resolution as well. And we have over 300 nonprofits across the Commonwealth who have partnered with us, who are really, again, we're making sure that we are showcasing Pennsylvania to not only visitors from across the country, but the world when they descend here next year.
Yes, and they were really excited about the telling of the other stories, because so many of these small towns have great stories related to various parts of Pennsylvania and our country's history that they were afraid was going to be left out again, I think. They
were, and I think something that's really important that has been so widely received is the fact that this is a culmination of 250 years. We're not just looking back 250 years ago. So there are communities who have historic stories or just unique and fun stories from 25 years ago, anniversaries from 50 years ago that we're trying to highlight. And I think that's why so many signed up so quickly. It gives them a seat at the table, it gives them a voice in this, and it really makes sure that their stories are amplified, again, through this anniversary.
And you guys are also doing a lot of activities trying to get kids engaged in this, traveling to schools, et cetera. Tell us a little bit about what you guys have been doing with that and what the reaction has been from teachers, kids, and parents.
Sure. So we have our Keystone Classroom Initiative, which is a pre-K through fourth grade program where we go in. It's a storytelling program. We read K is for Keystone, which is a Pennsylvania written and illustrated book talking about all kinds of fun facts about Pennsylvania, but most importantly at an age-appropriate level. And then we partner with Historic Philadelphia to bring in a historical reenactor of a Pennsylvania historical figure. Again, age appropriate. So these students have this book read to them and then sit in on an assembly. And we've reached 36,000 Pennsylvania students thus far in 52 counties. And by the end of this year, we'll hit 50,000 students in the 67 counties.
Great. In the minute or so we have left, we're going to try and get a few different things because things don't start next year, as we've already heard. You guys have been doing so much, and some of the really big events start this year, the founding of the Marines, we've done the Army, et cetera. So what are a couple things happening this year, and then what are the major events planned next year, which we all know around the 4th and going on forward?
Sure. So we have a couple more semi-quincentennial bell dedications this year. We're really amping up the awareness. As you mentioned, the Army 250 just passed. Homecoming 250 is this fall for the Navy and the Marines. And then we actually are doing kickoff events in all 67 counties in January of next year. We'll be doing a big Women's History Month event. We have a concert series that'll be hitting all regions of the Commonwealth from May through July 4th, where it'll culminate with the Well, Well, Welcome America concert in Philadelphia.
Major performers,
these are major concerts, major performances free to Pennsylvanians. So I think really excited. And next week, we are actually launching the mobile unit, Countdown to 250 mobile unit, that will travel to all 67 counties. It's engaging. It has AR components. It's actually a storytelling booth as well to tell your stories.
Great. Thanks for being with us. We'll probably have you back on and talk a little bit more about how things are progressing. When we come back, we're going to talk a little bit about how a federal Medicaid and federal budget bill might impact us here in Pennsylvania. Back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by Cross-State Credit Union Association. Credit unions, where people are worth more than money. To find a credit union that is right for you, go to ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is brought to you by the Association of Pennsylvania State College and University Faculties, representing the faculty and coaches who are devoted to providing quality public higher education for Pennsylvania's college students.
Welcome back to Pennsylvania Newsmakers. My guest today here is Kari King. Kari is the president and CEO of the Pennsylvania Partnerships for Children. What is that organization? What do you guys do?
Well, thanks for having me.
Sure.
Pennsylvania Partnerships for Children is the statewide child advocacy organization in Pennsylvania. We're nonprofit, nonpartisan. We're a little bit different, I like to say, in Harrisburg, where we're not doing direct service. We're not a membership association. We're really rooted in data. Looking at different data indicators on child well-being, and we use that to inform our public policy. We cover policy areas ranging from K-12 education, child welfare, early education, so things like child care and pre-K, to child and perinatal health.
So it's beyond the education side and into a lot of other areas. And I know in terms of looking at your board, you've got folks from the nonprofit sector, the business sector, et cetera. So pretty broad swath of people who have decided to engage in your activities.
Yeah, and really understanding that intersection too. What we really try to hone in on is it's all related, right? So a kid needs to be healthy to be able to learn in school. And so all of these outcomes are kind of intertwined. But I think in a time of increased polarization and kind of the political climate, we really are still very intentional in being nonpartisan and really centering the data.
Okay. So one of the things, or I guess the thing that you're most focused on these days is something that President Trump has called the Big Beautiful Bill. You guys would probably offer to differ on that description, right?
Yes, I'll call it the budget reconciliation bill.
Okay, there you go. You want to technically, that's fine.
No, and it's a good point too, where we do kind of balance both state and federal issues. Oftentimes we're here in Harrisburg, we're focused on the state capitol, but we do a fair amount of work in Washington, D.C. And really that has been most recently focused on Medicaid and really trying to educate policymakers and the public with what Medicaid is. I think there's a lot of misunderstanding. A lot of folks might confuse Medicaid and Medicare.
Exactly.
So really reinforcing that, and especially coming from that kids group perspective, that Medicaid is health insurance. It is not a check, not kind of an open-ended benefit for folks in Pennsylvania. It is health insurance. And for kids, it's really important to note about 40% of all kids in Pennsylvania receive their health insurance through Medicaid. And I don't know that a lot of people realize that. I think there's a misconception about who receives their insurance through Medicaid.
Okay.
So again, 40% of kids, it's about 1.3 million, and that's giving them access to primary care visits, making sure they're developing in a healthy way. So in Washington, when we've been going through, first the House passed the bill, where recently the Senate's coming out with their version. Regardless of the version, there's going to be some drastic cuts to the Medicaid program. It's going to come down to what happens in Pennsylvania and how we kind of adjust for those cuts at the federal level. And we're very concerned that at the end of the day, it's going to mean that kids will lose their health insurance.
So this bill, just to summarize, because it's hard to summarize almost anything on the national level, is, and then we'll talk more about this when we get back after the break, it's really what kicked it off was extending the federal tax cuts from a few years ago, and then turning around and saying, okay, we want to extend those tax cuts. How do we pay for them?
Exactly.
And your concern is how we're going to wind up paying for these.
Exactly, and there's a lot of messaging from folks in Washington that it's not a cut, and I think it's careful. You need to be careful in realizing that it is looking to the states.
Yes.
So adjusting things like what we call federal matching rates, things like that. So really looking at how the federal government has been paying for it, but now looking to state capitals like Harrisburg and saying, okay, you guys are going to be able to figure this out. We're estimating for Medicaid alone, it's going to be a $3 billion cut to the state budget. And again, policymakers are going to have to face some tough decisions.
Yeah, let's talk about that more in detail when we come back, and we'll be right back after these messages.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania American Water. We keep life flowing across the Keystone State.
Welcome back to Pennsylvania Newsmakers. We're here with Kari King, who's the president and CEO of the Pennsylvania Partnerships for Children, talking a bit about this federal legislation that's to extend the tax cuts, but actually they also have to cut as well. And you guys have a lot of concerns with this. It's the impact on families, particularly children, because you are based on being child advocates. But also you have brought up a few other things. That is, this is going to hit both urban areas as well as rural, and we here on the show we've talked a lot about what's going on with some of the medical issues in the rural areas as well, and that uncompensated care for hospitals where they have to provide the care and they wind up in the end maybe not getting paid for it. You're concerned that's going to go up?
Yeah, absolutely. With this kind of cost shift, something we elevate, I think, even kind of going back to what folks are aware of with Medicaid, I think sometimes the perception is that it's focused in urban areas, high poverty areas, and certainly it's based on poverty. But when you look at our organization releases fact sheets on our website, which is papartnerships.org, you can look up your state house member, state senator, or your U.S. congressperson, and it shows you the number of kids that are enrolled in Medicaid and CHIP by district. There's a lot of really rural districts in Pennsylvania that have just about the same percentage of kids on Medicaid or CHIP than you would see in your urban cores. So really just from that perspective of the rural versus urban from the kids and families. But then yes, certainly from kind of that health systems perspective, we are very concerned about rural hospitals, for example. As I mentioned, we're getting increasingly engaged in maternal health, just that connection between healthy mom, healthy baby. And a lot of what we've been lifting up is with some of the implications to rural health systems, you're going to be closing those labor and delivery wards. So there's true kind of day-to-day impacts on what this is going to mean for folks across Pennsylvania. But I think it's important to underscore that those systems in rural areas are really going to be hit hard and impact those families in those areas.
So let me play devil's advocate for a moment, because what you'll hear the folks who are pushing control say that the Medicaid program, and as you rightly noted, Medicaid is not Medicare. Medicare is insurance for seniors, although there's pieces of Medicaid that do go to seniors, have said this has grown unsustainably. We have to do some kind of controls here. One of them was, for example, interested in your perspective on this, requiring able-bodied single people who receive benefits to be required to go look for employment. I mean, how does your organization feel about that? How do we go after some of this what has been called uncontrolled growth?
Yeah. Well, and there is a direct connection there. You'd think as a kids group, we're not really focused on the work requirements for adults,
Sure.
but there is a connection there. But I think it does get back to just this broader messaging of how do they accomplish this in Washington with the pay-fors. I don't think that there's a way that you're going to be able to get the cuts they're looking for just out of the work requirements. A lot of folks on Medicaid already are working. And again, from that kid perspective, those barriers to coverage, so for their parents in that family, the barriers to coverage is going to impact the ability to cover the child. So when you're having that impediment for the parent in the family, it is going to have kind of that ripple effect that we are worried that a child would also fall off of his or her coverage.
So you guys do recognize the need to put some kind of controls here, because not only the growth but the debt is going up, which is an impact on children.
Yeah, I think it's a bigger conversation about how we are funding priority programs in our government and what those priorities are. I think most people would agree making sure that kids have health insurance coverage should be a priority, and making sure they're developing in a healthy way is a priority. So I think it's just a much bigger conversation that unfortunately elements like work requirements or other pieces of the budget reconciliation bill are kind of crowding out. But I think this is a moment where we can kind of take a step back and say what really is important, not just as a nation, but in Pennsylvania. And I think a lot of people would still agree that having healthy kids is really critical.
Yeah. So this bill has passed the House. You guys are obviously trying to work on having an impact on it. What are you getting from a Senate perspective? It obviously needs to pass the Senate and is sitting over there now.
Yeah, there's been some changes on the Senate side, not too much just in terms of what we're looking at for the fiscal impact to the state. Certainly the pieces around the provider taxes, that's a big piece of it, and I think is, if I would be a state policymaker in the legislature and the executive branch, I'd be watching it pretty closely and how we're going to adjust for that. But we're anticipating whatever happens in the Senate will go back to the House. So we'll continue. We have a great congressional delegation that's been very engaged, willing to meet with constituents. So continue those conversations.
So we just have a few seconds left. So I do want to ask you about something else that's been kicking around because it has direct impact on children, which is vaccines.
Yep.
There have been significant changes in terms of vaccines. Are you guys concerned about what you're seeing?
Absolutely. Since the pandemic, we saw a huge drop-off as kids weren't able to go in during the lockdown to get their primary care visits. Since then, we've all seen in the news the measles outbreaks. It's happened here in Pennsylvania in several counties. More broadly, when you're looking at the MMR, the measles, mumps, rubella, kind of that threshold from a medical perspective is 95% of the population being vaccinated. We are under that. There's several counties in Pennsylvania that are under 90%. This is a growing concern, and again, going back to the federal level, the cuts that are proposed are going to impact the immunization registry. So it's a big concern.
Well, thank you for that. Thank you for coming on. Hope to have you on again. And thank you for being with us. Appreciate all of you watching today. We look forward to seeing you on the next edition of Newsmakers.